Hi, good afternoon, everyone. I'm Li Ying, a Healthcare Scholarships Officer with Healthcare Scholarships and Talent. A warm welcome to Healthcare Scholarships Virtual Experience 2021. For some of you who have attended this morning's session, welcome again, and thank you for joining us in this segment. Throughout the 2 weeks of virtual events ending on 3rd March, you will get the opportunity to participate and interact with scholar ambassadors, scholarship officers, university partners, and professional representatives from various public healthcare institutions. We have an ongoing leaderboard and games section for participants to win attractive prizes, such as Universal Studios one-day pass, Disney Plus subscription, GrabFood vouchers, and many more. There are many ways to earn points, such as by attending programs, asking questions, and playing our daily games. Welcome to Dare to Care, a call to our future healthcare scholars. During this afternoon's information session, healthcare clusters, National Healthcare Group, National University Health System, and SingHealth, as well as Agency for Integrated Care AIC speakers, will share more about how you can dare to care. Before we begin, if you have any questions for our speakers, please feel free to type your questions into the Q&A box. If you'd like to direct your question to a specific speaker, please kindly indicate it in your question. And if you see any questions that you're interested in being answered, please upvote the questions. We have time for Q&A at the end of every speaker's presentation. The exhibitors' booths are also open today till 4 p.m. Feel free to chat with representatives from healthcare scholarships, the respective healthcare clusters, and AIC. Without further ado, I shall now invite our first speaker, Derek Tan, Chief of Manpower and Talent Division from the Agency for Integrated Care. Derek, please.
Thanks, Ling. Very good afternoon to all of you here who are watching the live stream. I'm Derek, and I'm from the Agency for Integrated Care, AIC in short, and I oversee manpower and talent development for the ComCare sector. First and foremost, congratulations to all those who have received your A-level results. You are now at what I would see as an important career crossroads. And I think the purpose of my sharing today is really to bring across some thoughts for your consideration and to encourage you to think about a career in the ComCare sector. But before I go into my main sharing, let's watch a video.
Care. What makes it so special?
How is it, Mr. Peter?
Is it the way it makes us feel? How it makes us smile? No. The special thing about care is that it doesn't care. It doesn't care who you are, where you're from.
Is everything okay?
It doesn't care if you're family or a complete stranger. It doesn't care how difficult things get. It always pulls through.
Slowly. Okay, slowly, yeah. Inhale. Good job. Okay.
You see, care is not something only found in the best of us.
Take it slowly, okay? Well done.
It lives in all of us.
Yep.
Hi, Derek. I think you're on mute, so can you unmute yourself before you continue? Thank you.
Oh, sorry. So I do hope you enjoy the short video. Every time I watch the video, it really brings a smile in me. And as you can see in the video, some of our ComCare workforce are featured in it. And I think the key message that we want to bring across is actually we are all born to care. And we're all born with the ability to care. And that, in our opinion, is the basic requirement for you, if you want to embark in a career in the ComCare sector. I will now move into my main sharing and to suggest some thoughts for your consideration. First and foremost, ComCare, community care, being part of the healthcare ecosystem, also share the same challenges that is facing the health ecosystem, which is to cope with an aging population, and not just having more people growing old, but also with multiple health condition and chronic condition as well. And you also see family size getting smaller, which in turn then put a strain on the caregivers. So that's the first thought. The second thought we want to bring across is that seniors are the key clients that are cared for by the ComCare sectors, and their needs are growing. And it's not just growing in numbers as well, but you also see that there is also a growing in terms of numbers of those with dementia. And lastly, aspiration and expectations of seniors are changing. And they are changing with each generation or each cohort of seniors. And at the same time, the ComCare sector has been asked to move more upstream along the continuum of care to look after those who are also active and healthy. And in line with the action plan for successful aging, we want to turn aging into a positive force. So allow me now to share a little bit about the ComCare sectors and who are the players in this sector. And I'll start off with AIC. And AIC being the sector agency for the ComCare sectors, our work for our seniors are all aimed at empowering our seniors and our clients and their caregivers as well. And at the same time, we want to transform the care community. And AIC works closely with our ComCare partners and organizations to create networks and community of cares and to ensure services are delivered, that the services delivered are robust and of trusted quality. All this work of the ComCare sector is why AIC directly supports the MOH 3 Beyond, especially the one that is focused on beyond hospitals to community. And given that our work provides for the entire spectrum of senior, from the well, active, to the pre-frail, to frail, and the severely frail, and lastly to the end of support. We also now, as our work go upstream into the well and active, we are also supporting the beyond healthcare to health. Our ComCare partners, our ComCare sector has grown over the past years. And the services which our providers and our partners are broadly classified into 3 areas as seen on the slides. And these are for seniors that require some form of care services. Care is delivered either through a center-based facility, which operates like a day center, or a residential facility where seniors are cared for as residents living in the facility. And also and they are cared for also at their own homes. And we also are seeing providers who now operate across these 3 areas as what we define as multi-service providers. For the well and active, as well as the pre-frail seniors, our ComCare partners also engage them through active aging and befriending program. And these engagement programs allows our partners to build a relationship with each senior that they come into contact and be able to respond to them whenever they need care or they require care. I do hope that short sharing did provide you some useful info for you to start considering a career in the ComCare sector. But if you were to ask me what is so unique about a ComCare career, I would perhaps narrow it down to this. And that is really that you are able to build a relationship with a senior under your charge. Walk the journey with him or her, and in that whole process, in that whole journey, see the incremental progress that you make in terms of their recovery. At the same time, you also can see the progress of how they could gracefully, purposefully, and age. And thereby making a real impact to somebody's life. And it's not just to that senior's life, but it's also to the caregivers of the seniors. So if you do want to be part of this, and if you do want to be part of the Singapore journey to build what we want to see as world-class environment for our seniors, which includes your grandparents, your parents, and even my parents, or even yourself, and perhaps I'm in the age group that I can say that I'm trying to be part of the journey to build that world-class environment for me to age. And where we see that seniors are going to be empowered to age actively. So go to these resources, as you can see on the slides, learn more about the scholarships that we offered, learn more about the development award and the sponsorship awards which we are giving out as well. If you can also choose to join us in these events as well, which are going to be happening over the course of the next 1 to 2 weeks. And for you to join us in all these events, we do require you to register for the info session as soon as you made up your mind. So the QR code is on the slides. The details of the info session are also on the slides. With that, I will end my sharing and perhaps open for any questions.
Okay, thank you, Derek, for sharing. We will now be taking some questions from the audience. So, okay, one of the questions is in terms of the medical advancements. So I guess most people have the impression that in terms of medical advancements, we see them pretty quickly in government hospitals, acute hospitals. So do community care organizations also keep up with medical advancements? And do they get it quickly, or do they usually have to wait for a while, like after acute hospitals have them in place, then it moves towards community care?
I would say that there are, and you do see innovation being, or rather there are technologies being introduced in the Comcare sector as well. But the kind of technology that are being introduced in the Comcare sector are very much geared towards caring for seniors, as opposed to those innovation which you see in the acute hospital, which is really more focused in terms of treating the particular medical condition. So I would say, example, that you will see that there are a lot of robots that sort of are being slowly introduced in some of the nursing homes, which is really meant to sort of is used as an engagement. So-called, to put it very loosely, an engagement point for the seniors. So seniors do get to engage with the robots as if they are human beings, and it's also in a way to help to generate that curiosity in the senior to want to engage with the robots itself. And the other example of innovation which I can sort of cite is also as a result of the COVID, and because visitors to the nursing home are being limited and controlled, some of our nursing homes are embracing what we call telehealth. So we do help our nursing home to bring in technology to allow them to remotely engage their caregivers through an iPad, and so it's like a FaceTime, right?
Yeah.
Where they get to see their caregivers through iPad rather than physically meeting, and that's really to overcome the current restriction, the COVID restriction. So those are some examples I would cite in terms of innovation. So I wouldn't say that the innovation is, or rather in terms of how you will put it, as in technology typically introduced for acute first, then to Comcare. I think it's really about whether there is a fit for purpose in terms of the technology that we want to use, I want to introduce. And secondly, it's also how readily are the environment in the nursing homes to embrace such technology. So we do need to teach our seniors how to embrace technology before we can start introducing some of this technology in. And so that will be, in a way, my response to the questions about innovation. to, as you walk through the nursing home, you just need to be more observant, then you probably will see some of this innovation that is being introduced in the home care sector.
Okay, thank you, Derek. I do think that in terms of the advancements or innovation, there are different purposes and perhaps different types of technology that may be more suited in community hospitals or nursing homes that may not be so relevant in the acute hospital settings. Yeah. Okay, let's move on to the next question. Okay, can you share some key differences between working in the community care sector versus the acute hospitals?
Okay, I'll just share one key difference, and I
Yeah.
think that has been sort of highlighted in my short speech, right, or short sharing, and that's that ability for you to build a relationship with the client that you care for, and because the clients are so whether is it whether is it a nursing home or whether is it center based, the opportunity for you to engage the senior is probably more prolonged than what our acute colleagues would sort of be exposed to, and because you are constantly being in touch with the senior, it allows you to build a relationship with the senior. And when you build a relationship with a senior, you in a way you understand him or her as a person. You also understand him or her in the context of his or her families, and in that context, then you become more like a friend to the person, and you walk the journey with the senior itself. And so I mean, the related to this point about being able to build that relationship with that senior is, and once you build that relationship with that senior, it's for you to then leverage on that relationship to see how you can influence the senior towards, in a way, following their treatment plan or following their recovery plan, rather than if you were to, I mean, the constraints of the acute colleagues is typically they see the client based on appointments, and appointments typically don't last longer than an hour. I mean, an hour is already very long.
Yeah.
But the appointments typically are short, and in that short span of that contact time, you need to, the focus is really to teach the client to remember so for example, a rehab session, you need to teach them how to do the exercise so that then when they go back, they have to find that self-motivation to go and do the exercise. It's different in the home care sector because you're seeing the person every day or literally every day, right? In a way, you can be there to encourage, and then if you're observant enough, then you will be able to observe what are the things that will perhaps bring out that motivation in them to want to do the exercise. Yeah, so that I would sort of say is the difference between acute as well as the home care lah. Is the ability for you to build a relationship with the client lah.
Okay. Touching on this question, then am I right to say that, for example, if a candidate is interested in healthcare and they are at a crossroads deciding whether they would like to go towards acute care or community care, if an individual possesses, the innate ability or have a better interest in building long-term relationships and really want to accompany the patient or the client towards their journey to recovery, in the long-term sense, they will be more suited for the community care scholarship or community nursing scholarship?
I would say that yes. I mean, you are in a way looking at whether you want to go a career with acute or with com care. I think probably one of the difference would be that you enjoy building a relationship with the client, and you also want to see a real progress of what you're being trained to do. So I wouldn't say that the acute you don't see progress, you do, but it's perhaps because of that regular contact with the client and with the seniors, then you can see the progress. Of course, the other consideration is the key client in home care sectors are seniors, and so you do need to enjoy interacting with seniors, enjoy working with seniors. So I would say then these are the two key so-called requirements. One is really for you to enjoy interacting with people, building relationship with people, and
Mm.
see impact you make to a person. And second is you need to enjoy interacting with seniors. This is a sector
Okay.
for senior.
Okay. Yeah. So we do have a question because we talk a lot about seniors in community care. So are there actually any other beneficiaries besides seniors within community care? Yeah.
Okay, so earlier in my slides as well, I did say that Singapore is facing aging population. So
Yeah.
I think seniors are the key client. But I think related to that client will be their caregivers.
Okay.
So in a way, AIC and some of our Comcare partners as well are also looking at how we can support our caregivers in a manner such that so in the same manner as we are doing for our clients, to be able to empower them. And I think for the caregivers, the key part is really about letting them have a peace of mind, to know that their parents are being cared for, and in an environment that they know that the service, the quality is there. Yeah, so other than seniors, I think the other key client will be the caregivers.
Okay. Thank you, Derek. We'll move to the next question. Okay, so there has been a lot of news, and we see that the ministry and the government in general is pushing for more awareness in the community care sector. So would there be more demand for community care professionals in the future as compared to acute care?
So I mean that I think the key drivers of in a way the demand for manpower in the Comcare sector will be the services lah. And I think if you look at the aging population, that's really one key driver to drive up demand for healthcare services. And because seniors are cared for, or rather seniors in the long-term care sector are cared for over a longer period, as opposed to them staying in the acute, that in a way also compounded that whole demand. And so all this in a way puts, or rather, okay, so maybe I'll just say that if you to cast our eyes forward to 2030, the plan is for us to grow the Comcare workforce by 100%. So that in a way is the demand for the professionals and the workers for the sector itself lah. Yeah.
So okay, I think based on your response, there really is a huge demand
There
growing.
is huge
Yeah.
demand.
So for students who are interested to explore careers in the community, I think this is the right time to start thinking about it, because if you sign up for a scholarship, you'll still need to go through perhaps like 3-4 years of studies, and then by the time when you graduate, perhaps the Comcare sector has also grown to a certain level, and it will continue to grow in the future years to come. Yeah. Okay, for the next question, Derek, do you know whether there are opportunities for community care scholars to work in acute hospitals during the bond period? Okay, I think in terms of the scholarship wise, maybe I can share a bit more first and you can touch on it. Yeah, so for community care and community nursing scholars, you do get a short stint, about 6 months in the acute setting before you move towards community care organization that you've been allocated to. So these 6 months is really to allow you to, get to know your the medical services as well as the skills and knowledge needed in a clinical setting in acute hospitals, and then how you can actually apply them when you move towards the community. Yeah, Derek, do you want to add on? Yeah.
Yeah. So I would perhaps also add to say that that short stint for you over at the acute hospital is also for you to form networks, so that then and these networks then become your resources, right? Whenever you are in your Comcare, when you're back in the Comcare sector, and as you deliver your work, as you go on with your daily work, and if you need certain resources, you know where to reach out to who. Or you got a friend in the acute sector that you can call and ask about things. So I think beyond that structured career exposure posting in the acute setting, I think that intent is really for you to contribute in the Comcare sector. Within the Comcare sector itself, and depending on the organizations that you are being attached to or you are being assigned to, some of our organizations, as I earlier had sort of raised, are what we call multi-service providers. So they do, in a way, operate, say, a senior care center with a nursing home, and they perhaps also operate home care services as well. And those providers then will be able to allow to, in a way, plan for rotation within the organization and have you exposed to different settings. And the different setting in a way is also give rise to different work challenges as well as the scenarios for you to put your clinical practice, put your clinical skills into practice. So I would say that there will be, I mean, as part of that career development plan, there will be steam for you to go to acute. And then thereafter, within the Comcare space, there are also opportunity for you to rotate within your organization to be exposed to different settings. And then I think beyond your bond, then of course the hope is for you to continue within the Comcare sector, but then it also doesn't preclude for you to join the acute thereafter as well.
Okay, thank you, Derek. I think we'll take one last question for today's session. We've talked a lot about community care organizations and how AIC partners them. So AIC as an organization itself, can you elaborate what kind of services you provide and whether they're applicable for the public? Yeah.
Okay, so AIC is the sector agency for the Comcare sector.
Yeah.
And if you look at the mission and the vision chart itself, you see that there is two key areas that we talk about. So we do have colleagues who are helping to empower the clients and the seniors, and those are the colleagues that work directly with seniors who are so if you kind of remember that back in a couple of years, MOF sort of introduced this office called Pioneer Generation Office, and then slowly then becomes Silver Generation Office. So Silver Generation Office actually now merged with AIC and is part of AIC. And our colleagues in the Silver Generation Office, they do go out and to the grassroots and engage the seniors, to talk to the seniors, to befriend the seniors, and to, in a way, to also make sure that when we engage, we in a way hold them. And if let's say they do need some information about the care that they need, then we'll do that referral to within AIC to channel them to our Comcare providers. So that's one area of work that is under AIC. The other area of work under AIC is to support the whole vision to transform the care community. And for this piece of work, I think we do have colleagues who are working closely with the Comcare providers and to look at putting in place services. So we do have our service development divisions that look at put in place a program to introduce new services, for example, like new services, or to grow the service in, say, palliative care services, or whether is it in the residential space, residential care space, primary care. So those are the service development division. And we also have a division who are what we call directly working on key enabling areas such as manpower, like my division is looking after manpower for the entire sector, digitization, productivity, quality. So those are the together with the service development division, I think what we want is really to transform the Comcare sector into one in which service are delivered that is of quality and is trusted.
Okay, thank you.
Yeah, it's a bit, I'm not quite doing AIC justice because the amount of work we do is really diverse and wide. But I do hope that that gives you a little bit of a flavor of what AIC does. And any of you, if you are keen to want to know more, do join us for the info session. Yeah.
Okay, thank you, Derek. I do think that you touched quite a huge variety of topics as well as the scope of community care in today's session. So thank you very much. And we have come to the end of AIC segment. So for the next segment, we will have 3 speakers from the National University Health System. Okay, first we will have Michelle Leong, Senior Manager Human Resources from NUH, Shirley Lim, Manager, Human Resources from NUH, and Jamila, Head of Allied Health from National University Polyclinics. So the three speakers will talk more about the NUHS as well as institutions within the NUHS cluster. Michelle, please.
Hi, thank you very much. A very good afternoon to everyone. Okay, so just a quick brief introduction about myself. My name is Michelle. I'm from the Human Resource Department. My portfolio involves performance management, scholarship and sponsorship, as well as special projects. So I'm happy together with me today with Shirley to actually share more about NUH and what we have to offer. Okay, next slide, please. So NUH is a tertiary hospital and a major referral center with medical, surgical, and dental specialties. The hospital has first opened its doors to the public in June 1985 as Singapore's first restructured hospital. As a member of the NUHS, National University Health System, the hospital works closely with the rest of the entities within the NUHS group, the acute and community hospitals, the national centers, polyclinics, to deliver a seamless and sustainable patient care for all our patients. In addition, NUH also collaborates with the schools in nurturing the future healthcare, as well as the professionals and the leaders. Okay, next is the one ecosystem, where you can see that there are three circles there that represents the clinical care, research, and education. So NUH is actually part of this one ecosystem with this tripartite mission in providing excellent clinical care, and at the same time focusing on education to develop the next generation of the healthcare professionals, and also strongly supporting the research part by developing a strong research culture to push the boundaries to actually break the new ground. Okay, next. Okay, so each and everyone in NUHS, we uphold and echo our core values. Our mission is to strive to improve the health of our community by combining the strengths of the clinical care, education, and research to deliver the quality and the value to our patients. The 6 core values that are shown here are teamwork, respect, integrity, compassion, excellence, and patient-centeredness, which each and everyone really uphold the core values and deliver the best that we could in the organization. Okay, this slide actually summarizes the strategic mission as well as the 4 key goals. The strategic mission will be to be a leading academic health system, improving health and driving transformation. In order to actually reach this, there are 4 key goals that NUH echoes on. Firstly, and most importantly, is to care for our patients. So in this part, the hospital strives to actually provide incredible care, build community services, and we do have a patient experience survey score. Okay, this survey actually is being held every 2 to 3 years to have a gauge about how well the hospital has been doing and what are the areas that we could further improve. In addition to caring for our patients, our people are also our main focus. And we take care of their well-being, their mental health. We put in a lot of effort in growing them, upskill them in order for them to fulfill their fullest potential. And we also look into simplifying work processes. So on the organization, we do have this employee engagement survey to actually have a measurement, outcome measurement of how well or what can be done better for our people. In terms of creating our future, the hospital has constantly been innovating and creating a lot of new ways to change existing processes and practices. And we also develop the future and the new NUH in order to actually hit another milestone to be able to enhance the entire patient care services. And we do also ensure sustainability we look into growing our resources, we eliminate waste, and we also try to optimize the expenses to increase the productivity. Okay, the next few slides, we will share more about how and what are the initiatives that we have done to care for our patients. So as mentioned, patient is the focus of the hospital, and we not only provide good service, but we also want to delight our patients. And NUH has been also featured in the media for numerous times in providing incredible world-class care. So as you can see here, there are snapshots of all the media coverage in Straits Times and the Taobao. Okay, next will be some of the major clinical milestones that we would like to proudly share. Since 1986 till now, in fact, until 2020, the hospital has been achieving a lot of clinical milestones, be it on the international or at the local level. And then to relate more recently will be in year 2020, where NUH and NUS actually co-developed a reusable and foldable protective shield. This is actually to provide additional protection for our healthcare workers who are actually handling the COVID-19 patients. And as a tertiary hospital, we provide multidisciplinary care. It's a one-stop center with different disciplines such as medical, pediatrics, dentistry, surgical, orthopedics, O&G support services, and diagnostic services. So all the disciplines are actually offered by NUH itself. We also care for our people. As we mentioned, that our people are our important asset. And then we make sure that we engage and care for them. We build morale and pride. We care for their well-being. We build their resilience so that they can continue to provide better patient care. We develop our staff through programs and courses, and there's also a talent development program in order to build a strong pipeline, and we support them for their growth, and we make sure that we build a strong foundation of our resources and the manpower that we have in the hospital. So our people are also featured in the media for their achievements and also their contributions, as well as their breakthrough in research and so on. So these are some snapshots of the media coverage for our staff. And we also recognize our staff through awards. So in terms of awards recognition, it could be an external award or internal award. We do have many staff who are actually being recognized on an annual basis. And besides recognizing them for their good work, we also feature them in the hospital. And then it is also encourage the rest to actually take on this as a role model to be incredible people providing incredible care. Okay, next I will pass on to my colleague Shirley to share more about nursing and allied health in NUH.
Hello, good afternoon, everyone. Yeah, so I'm Shirley, also from the Human Resource Department. So just to share with you, annually, there will be the patient experience survey that MOH will actually send out to the patients for them to do. And we are proud to say that NUH has scored very well. And how did we manage to do it? It's all thanks to the people in the organizations, all the frontline healthcare professionals, as well as the back-end support staff. But it's because we have happy staff, that's how we manage to deliver good patient care. So for us to have happy patients, we need to have happy staff. And Michelle has shared on how we have managed to develop and recognize our people. And then I'll move on to share more about the professional track for the nurses, pharmacists, as well as the allied health professionals. So unlike the past, the nurses are wearing many hats now. Last time they are more doing the cleaning kind of work, but right now, other than doing like bedside care, being a caregiver, they also have to be a good listener, to listen to the patient's pain, worries, concerns, yeah. And with that, they can then be the patient advocate to share with the doctors or even the next of kin on how to make the patient feel better, whether in terms of the treatment or whether is it more care and concern that the patient need. And Singapore is an aging population, so most of the patients are actually the elderly, which during the earlier presentation, it was also being shared. So some of them, they may not be able to speak English, they are speaking dialect. So our nurses, in fact, quite a number of them are able to do translations or at least speak basic dialects, so that the patient feels that there's no barrier between the nurses and them, and it helps to build that kind of rapport with the patients. And in the healthcare, we are a multidisciplinary team. That means the nurses do not only work with the doctors to just care for our patients. We also need the allied health professionals, the pharmacies, sometimes even the patient service associates, the health attendants also come into play. So with many people into coming with the discussion of how patients to be cared for, definitely there may be different perspective and differences may come in, and nurses also come in to help to be the conflict manager, either at the hospital setting or even from the family setting, because sometimes families may have differences in terms of they cannot reach an agreement of how to treat that particular, whether should they proceed with a particular procedure or not. Then the nurses also come in to be a neutral party to help to resolve any conflict if there is any. Right. And just like I mentioned, nurses do not only do clinical work, but they are also doing a lot of like research. We also have these prescribing medication courses that the nurses go for, whereby nurses walk around with the doctors to have that kind of discussion with the doctors in terms of how the kind of medications. And sometimes doctors do take the feedback that the nurses give to them. Yeah. So this actually give the nurses the sense of satisfaction in their role. Yeah. And in NUH, in fact, in all PHIs, the nursing career track are pretty standardized. So yes, so they will come in as a staff nurse and then they will progress. Once they reach the assistant nurse clinician level, they will then think whether which career path they want to go into, either being the management career track, whereby they will lead a group of nurses under them to develop the group of nurses in terms of their career development, progression, etc. Or perhaps their interest falls more on educating, so they may like to do preceptorship for those nursing students who actually come to our hospitals to do clinical attachments, or they may like to go to the school to teach. Then they'll go under the education track. Last but not least will be the clinical track, whereby they may decide to go in depth into a particular specialization, and then they'll go to pursue the masters in nursing and go on to the advanced practice nurse track. Yeah. And I'm proud to actually share that in NUH, we have this Gnrp, Graduate Nurse Residency Program. It started, I think, by the first, and actually started more than 10 years ago. Because as a student nurse, the kind of expectations, the kind of roles is definitely very different from a professional nurse after you graduate from the school. So then how can we help the fresh graduate to actually transit from a student to a professional nurse? So the nursing team, together with HR, we actually came up with this 2-year program to actually help the fresh graduate to transit. During the first year, they'll actually go for some classroom-based courses, which includes not the clinical aspect, but more of the soft skill aspect, which includes things like the leadership, how do you resolve conflict either with your colleagues, or how do you manage some more difficult patients, for example. Then thereafter, during the second year, there'll actually be this one-to-one mentoring program. So mentor, they're actually not the RO, they are not the supervisors. So the staff can then feel very at ease to share if let's say they happen to face any difficulties at work, be it with their colleagues, with their supervisors, and this mentor who has many years of experience or even have a team of her own, she will then be able to share her experience and share her view and guide these new nurses in their career with us. And we have received plenty feedback, positive feedback from the fresh grad that, you know, this program is actually very helpful, yeah, to them. So in NUH, the professional practice model that integrates the nursing practice and the nurses actually exemplify the care and services through this NICE, this NICE model, which stands for nurturing leaders, nurturing nursing leaders to lead the juniors, to guide the juniors. And we also emphasize a lot of innovative and knowledge, which stands for I, innovative and knowledge, because constantly we are looking at innovative way to care for our patients, and as well as gaining more knowledge. With that more knowledge, then we are able to think of better solutions, better care for the patients to make patients feel better. And C actually stands for collaborative. So collaborative partners, because nurses do not work alone, other than doctors, like what I mentioned earlier, they also work with the allied health professionals like the medical social workers, the pharmacists, the physiotherapists, etc. And last but not least, E is exemplary professional. So we always want to have a very professional outlook to not only the patients, but also to the core workers in the hospital. Yeah, so that's NUH nursing for you. For allied health and pharmacy in NUH, as some of you may be aware, allied health, there are like almost into about 20 different disciplines. Yeah, so we have discipline like speech therapy. Currently, you may be wondering, oh, should I go into speech therapy or should I go into diagnostic radiography? We also have dietetics, physiotherapy, so on and so forth. So this makes work very interesting because during your day-to-day, you do not only liaise with your own professional, but also other disciplines, and you get to learn from each other. With regards to the career track, yes, it may look, okay, so for the fresh graduate, they come in as a physiotherapist or a pharmacist, for instance, and then they move up the career path to be a senior. And then once they reach the principal level, same thing, they'll get to choose whether they want to focus more on the clinical aspect, management, education, or research. So within, although you may only see 4 boxes, but actually within the 4 boxes, there are individual job grades. So you may be promoting within the senior level, but there is an increase in job grade. So progression is still evident, can still be seen. Yeah. So after talking so much about, you know, how NUH value our people, how we develop them, how they progress, let me share with you 2 of the examples of how our own staff have actually benefited from our progression as well as sponsorship opportunities. So the first one is Lim Siwen is currently the head of our pharmacy department. She actually joined us as a fresh graduate with a degree in pharmacy from NUS. And during her career, she has progressed, and we even sponsored her for her PhD in education because she's interested in the education track. She was actually the staff who come up with the postgraduate year 1 PGY1 for our pharmacy residency, and then now it's actually been recognized by the Ministry of Health. She's also the chairman of our National Pharmacy Residency Examination Committee. So over the years, she has progressed from a junior pharmacist all the way to be a section lead of an oncology pharmacy specialized in cancer patients. And now she has become our head of department for pharmacy. The second one is Dr. Isaac Xia. Isaac actually joined us after his degree in speech therapy from the University College of London. Similar to Siwen, he also came in as a junior speech therapy, and then he progressed his way up to be a section lead of the speech therapy. During his career with us, he was also being sponsored for his PhD in rehab science at the University of Florida. And during both of their employment, we've also identified them and sent them for many leadership programs, as well as courses to equip them with the leadership skills to lead a team. And now Isaac has progressed from being a section lead of speech therapy to now the head of department for our rehab center. Right. So talking so much about our people, I remember just now, Michelle also mentioned about how we actually innovate and then improve our structure building. So we are constantly also improving our facilities so as to ensure that when patients step into the hospital, they don't feel so scared, so eerie. We wanted, because they're already sick, we wanted to give them the kind of very positive feel, relaxed. So the next slide will actually show you what our master plan is, a site preview. This will what the new campus, NUH campus will look like, because one of the main building was pretty old. So we are now planning to redevelop that particular building. And this is the night view of how the redeveloped NUH campus will actually look like. Yeah, so with that redevelopment, other than making the building look nicer, we also want to make sure that the services and the movement of patients from one center or one service or one clinic to another is more smooth. Yeah, and it's the direction is clear, so that they will not feel very lost within that big hospital setting. Yeah. So having said so much, thank you for listening to us. And we do hope that you will take up a healthcare discipline study and take up the MOH scholarship, ultimately do choose NUH. We hope that you will grow with us. Yeah, from a little bean sprout to like what Siwan and Isaac has gone through, from a fresh graduate to now a very strong tree leading a department and guiding them. And then thereafter, you can soar with us to greater heights, and together we can make NUH a proud place for our patients as well as our staff. Yeah, thank you.
Hi, Jamila. I think you can share your slides and continue from here.
Great. Hello, everyone. Right, I'm here to present to you the allied health services in primary care, while my colleagues have shown you the spread of our tertiary facilities and tertiary services. I would like to introduce to you the primary care arm of NUHS. Over the past few days, you have heard about us within the 3 clusters, what's so different between us, and what are the DNA within each specific cluster that you have been introduced to. NUHS is our mission is what my colleagues has mentioned. We wanted a healthy community. Basically, we wanted most of our people in the West to be cared at home, as healthy as possible at home, to provide that value amongst their family and friends. With this in mind, there is a lot of push and impetus to ensure that our community and primary care arm is as strong as it should be. What NUP or NUHS rather is supporting over 1 million people in the West. And if you are living in the West, I'm sure you're familiar with the polyclinics. There are 6 currently, from all the way to the top, in Choa Chu Kang. We have a newest member that's coming on board, Bukit Panjang, and across for the next 3 to 4 years, we have a couple more that is going to come up. And because of that, polyclinics has been we have upgraded a lot of our facilities and a lot of our services as well to ensure that we upkeep and be at par with the mission and vision of NUHS. Why family care? I'm sure that this is something that is very familiar to a lot of Singaporeans and locals. Actually, if you are sick, your first point of call is usually the polyclinics. We want to give value care, and the best part about the polyclinics is we are essentially a trimlet model care. what we mean is that we will see a lot of patients that comes through. We triage them. We are the gatekeepers of the institution. What primary care does is that we assess you, screen you, and thereafter facilitate your upward journey. And in the event that upward journey is not necessary, we will put you, we will keep you safe at our own primary care level until you are well enough, and discharge you accordingly. And even discharge, for the elderly folks, we don't discharge you totally. We have partners that we kind of integrate and ensure that our fourth cluster, the community health posts and our community health nurses are aware that you are in the community and you may seek help time and time again. And we don't, we always keep you in mind. So I'm here to speak about allied health services in the polyclinics. Allied health services in the polyclinics wasn't a norm 2 decades ago. It's quite recent, over the last decade. And essentially it is not available in all polyclinics. As you can see here, we have currently the dietitian, the social workers, the physiotherapists, the podiatrists, and the psychologists. We also have the lab and the red colleagues and the pharmacists as well. Together, we are actually holding the fort for the allied health services. So what do I mean by the community allied health? You have heard a lot in the last few days about how allied health it's all about upgrading and specializing. There are some people who are actually, who prefers to be in the community. And when I say in the community is essentially we are tasked to see the masses, and because we are seeing the masses, you need to be on your toes to be able to see what's wrong with the patient within the few minutes that you see. And sorry, yeah. So what we do is that since you have only less than 30 minutes to talk to patients, you are essentially required to get people to triage them accordingly. Most of the time, we prefer to see seniors, but recently I have opened the recruitment to recruit a lot of interns and a lot of SIT students as well as a teaching institution, because NUP is old enough now to actually have a lot of supervisors, and most of our people are specialists in their own area, because there are certain conditions that we are tasked to look at the community level. Case in point is musculoskeletal for the physiotherapists. And yeah, this is something that is shared before. Most of you, when you start off as a basic level, these tracks are familiar to a lot of us. For allied health, as you journey across, NUP do, as part of DNA of NUHS, we do support postgraduate studies for your master's, even for your doctorate as well. And the best part about NUHS, because it's an academic cluster, we do encourage cross-facility attachments as well. So you don't worry that, oh, I have enrolled myself in the polyclinics, can I ever get specialization in the hospitals? Yeah, that opportunity do happen in NUHS as well. So not to worry, because we have end-to-end care. I think that's it.
Okay, thank you, Shirley, Michelle, and Jamila for sharing. In the interest of time, we didn't have enough time for a Q&A session with the 3 speakers from NUHS, but our exhibitors booths are actually open today until 4 p.m. So feel free to pop over to the exhibitors booth if you have any questions pertaining to NUHS or NUH and NUP specifically. We will now move on to the next segment. So for the next segment, we will have Ling Chi Meng, manager from National Healthcare Group, to do a sharing of NHG. Chiming, please.
Hello, good afternoon, everyone. Chimeng here from National Healthcare Group. I am from Group HR. So I will share a little bit about what is NHG. So for a start, in NHG, how we envision care is a little bit different. So we really don't look at just addressing the sick, but we are really looking at also in terms of preventing illness and looking after our population from the moment they arrive as a baby all the way until end of life care, eventually when they leave us. So this is really encapsulated in our vision statement, adding years of healthy life. So how can we make sure that our population stays well and avoid them getting into using health services in general, eventually before they, towards the end of life care. Yeah. So within NHG, I think what happened is in terms of vision, earlier on we shared is really adding years of healthy life. So that really permeates through our entire mission, and also in terms of how we have come up with our corporate core values. So our mission is really to improve health, reduce illnesses through patient-centered quality healthcare that is accessible and seamless, comprehensive, appropriate, and cost-effective in an environment of continuous learning. What happened is that we only not believe in giving care to our patients, but we also acknowledge that giving our staff access to the newest technology, the best technology possible, so that we can continue to give good care is critical as well. So all this summarizes also in terms of our core values, where we are really looking at people-centeredness, not just towards patient, but there is also this focus towards internal staff, among staff as well. The other one is also on pertaining to integrity, so that each one of us discharge our work to the highest possible outcome and effectiveness. In the same time, we are all in healthcare, so compassion really plays a very, very crucial role in terms of how we treat our patients and also amongst each one of us as well. And lastly, stewardship. That one is actually really looking at how do we discharge our care. We just don't do our work, which is given to us, but we strive to make sure that we go beyond whatever we do, right? So just before I share on NHG institution, just a little bit background. So in 2017, before 2017, there was really a 6 public healthcare sector. In that particular year, MOH actually reorganized all the 6 public healthcare system into 3 clusters eventually, which NHG, if you look at the map here, we are really residing in a central area. So that's where we will be serving the population. We actually combined with Alexandra Health System back then, which was formerly Acute Hospital. So you are really looking at the teal area of the map. That is where we are focused in. So this particular slide will show you the range of services that we provide in the central region for Singapore. So primarily you are really looking at the acute hospital. Primarily, most of them are Tan Tock Seng Hospital, Acute Hospital, and there will be an upcoming new hospital in Woodlands area. That is what we call Woodlands Health Campus. So these are our 3 acute hospitals. We also have our community hospital, which is Yishun Community Hospital. I will go a little bit more detail later on. And we also have our primary care setting, which is provided by our NHGP polyclinics. And there will also be 2 national centers, which is Institute of Mental Health and also National Skin Center, right? So how we organize the entire care delivery within NHG, we have primarily broken them into 3 major parts. So I will start first with the Health City Novena. So Health City Novena is really anchored by Tan Tock Seng Hospital, if you look at the map itself. So on the left-hand side, that is where the current Tan Tock Seng Hospital is. Some of you probably will go there quite frequently, be it for social or leisure. Just to share, there is really a lot of development coming up around the Novena City area. So primarily, we have actually the National Center for Infectious Diseases is already up. There are actually upcoming developments as well. As you can see, example, in the bottom middle, there will be ambulatory and expansion building. And in addition to that, to the more right-hand side bottom, it will be the new National Skin Center expansion, together with the NHG HQ will be subsequently moving into that as well. On the top part of the picture, we are also building our integrated care hub. So it will integrate both acute and subacute care as well. And also there will be a lot more integration with our partner in terms of education, the Lee Kong Chian School of Medicine. So that's a little bit more to the top right-hand side. So the model of care has been evolving. So in terms of what we continue to serve our patients, the hardware needs to be there as well. So which is why this entire Novena area is slowly being developed so that we can really better serve our patients right in the middle of Singapore. Okay. So how they have actually designed the Health City Novena, they are really looking at 4 key principles. It is really a place for healing, a place for leisure, and also not forgetting a place to meet as well as to enrich. So if you look at the map earlier, you have seen that it's really a place whereby there are hospitals and as well as there are a lot of care facilities. There is also a shopping retail as well, so that allows people to interact, which ties into the third one, the place to meet. And lastly, we also do integrate LKC, Lee Kong Chian School of Medicine. So that's how we, that particular city has been designed with that intention in mind, right? I will just move a little bit more pertaining to what we call the central region, so-called anchored by Tan Tock Seng Hospital. Within this whole area, sprawling across from Ang Mo Kio all the way right down to Novena area, there is really a wide range of different facilities and care facilities as well. So you are really looking at hospital care. There is also polyclinics available for the general population as our care model continues to evolve from an acute-centric model. There is also intermediate and long-term care and even end-of-life care. So there are some nursing homes within the Novena City area that Tan Tock Seng Hospital works very, very closely with in terms of care integration. There is also the transitional care and community care model. That is what we wrap up as the central region. I will move on to a little bit to the north side, where Yishun Health is at. So through this picture itself, you will see Khoo Teck Puat Hospital, Yishun Community Hospital, as well as Admiralty Medical Center. So this is what we define as the Yishun Health Zone. So this picture shows you a general picture of Khoo Teck Puat Hospital. It is a very, very interesting hospital, whereby the whole hospital has been designed and with an intent to integrate the environment as part of its building. So for those who have been there, they actually do extend a large part of their building and surroundings into the Yishun Pond itself. So Khoo Teck Puat Hospital believes that while you are seeking care, the supporting ambience should also allow a patient to be so-called treated well. It should be holistic care. So if you have been there, there are really very, very nice integration with the pond, whereby a hospital will allow patients to do exercises. The community also actually have exercises within the hospital ground as well. So it is really a further so-called expansion of how care community can come together as one overview, right? So the map, the picture on the bottom half of the slides pretty much explains a little bit in terms of relationship between Khoo Teck Puat Hospital and Yishun Community Hospital. So I will just move on next to the picture. So how care is being integrated within Khoo Teck Puat Hospital and Yishun Community Hospital is, they believe that there is actually should be a link between these two hospitals. So when a patient is admitted to Khoo Teck Puat for an acute episode, they will try to get the patient addressed and treated ASAP. Once the patient has stabilized, but assuming if they need continued care, what happens is there are actually linkages between the two hospitals, and the patient will be actually pushed over to the Yishun Community Hospital for continued care. And within the premises there at Yishun Community Hospital, the care model takes on a little bit more proactive and also more holistic care, which is an extension of what Yishun Health believes in. So the patient is also free to leverage, example, the very, very nice environment there as part of getting well and recovering well. So in terms of that, once they are discharged, they have also started a lot of programs within the community. Example, like for the more senior citizen patients, there are really aging in place program, and there are also a lot of community nurse posts at there as well. So one of the more interesting model they have also adopted is the wellness compound. So what this means is really an initiative initiated by Acute Hospital. So this is where they will kickstart a lot of preventive care model. Example, how engaging the community, how do you maintain and prevent illnesses from coming on so that you continue to stay activated, as well as looking out for your care itself. So they believe in being healthy right from the start itself. So these are some of the little things that Yishun Health has kick-started amongst the Yishun area. I will move on next to the next hospital. For some of you who may not be aware, just to share, this is one upcoming hospital in around Woodlands area. So they are currently in construction, expected to open around 2023. So how this entire Woodlands Health Campus is designed is it will be one integrated campus. Instead of segregating care, example, like what we saw just now in Yishun Hospital, what happened is for Woodlands, there will not be, example, a hospital and then a community hospital and so forth in that sense. But everything has come together so that this oneness of self is really at the right of center of whatever Woodlands will be doing. Okay, they will also be very focused in terms of trying to engage the population in around Woodlands area. We have also done some studies showing that the population profile there tends to be younger. And one of the key things that they are looking to do is really preventive care. So one of the key initiatives that will be starting on would be really to go into the community and then ensuring that everyone stays healthy so that the need for more what we call acute care requirement is much more reduced and managed so that we don't overstress our healthcare system. All right. I'll go on a little bit in terms of the other services within the NHG family. So other than our hospitals, we also have our primary care provider, NHG polyclinics. So it is really smack right across the central region. So currently we have Ang Mo Kio, Toa Payoh, Yishun, Hougang, as well as Woodlands, as also Geylang. There will be upcoming newer polyclinics coming as well. As you can see in the map, Sembawang, Khatib, Serangoon, as well as Kallang. So as our care model continues to evolve, there is also a need to review how we provide services to our patients as well. So, and at the same time, our healthcare model is slowly changing from a very, very acute hospital-centric towards more primary care area. So you will see that there is this growing focus towards a more primary care area. So that's something that probably, for some of you who haven't really decided a career in healthcare, you may want to consider that there are really a lot of opportunities that is upcoming within the healthcare sector. All right. I will just go on next to our national centers. So for a start, Institute of Mental Health is also part of the NHG family. It is the only tertiary psychiatric institution within Singapore. For some of you who are really thinking about pursuing a career in mental health, as this area is slowly coming to the forefront of the healthcare needs of Singapore, you may want to consider pursuing employment eventually with Institute of Mental Health. So they really offer a very, very wide range of services to the patients. And at the same time, they also believe that care for mental health patients should not be institutionalized. Instead, they are really looking at how to integrate our mental health patients back into the community. So they are trying to remove the stigma, which we have slowly changing one step at a time, so that our mental health patients can really recover and integrate back into society. I will just move on next a little bit to the other national center within NHG. That is the new the National Skin Center. So currently the old National Skin Center is being so-called, is still in Mandalay Road. So this is the National Center for Skin Issues. So moving forward in FY 2022, they will be moving to a new center, which is just beside the current center. So that's something that probably some of you might be interested in. So these are the full ranges of services that NHG has. Adding to that, we also have two very interesting units within NHG. So one of them is diagnostic, whereby it is really a one-stop imaging and laboratory services. So this particular service, they do provide a lot of supporting services to our internal so-called institution. Example, they provide lab services to NHGP. And also for the other unit that we have is really NHG pharmacy. So again, this is also a service that they actually provide to a lot of our primary care sector. Yeah, so within NHG itself. So in case there are so-called, some of you are thinking of, I'm not sure if I want to do work in acute setting, like example, a hospital, but I may want to consider something that's a little bit more, a little bit different. So example, like your Mac lab technician, your diagnostic radiographers, or even your pharmacists, you may want to consider a career under NHGD and as well as NHG pharmacy. All right. So this particular slide explains how NHG looks at how we provide care to our population. This is a very, very busy slide. So broadly, how to read this particular slide is really all our institutions that I've just explained earlier come together to provide system excellence, which is on the top part. So we are really looking at how we make sure our hardware is able to support our patients and population. So coming together will be in the central area, whereby you will see this little round shaped island that is defined as our patient itself. So we also believe that while we provide the hardware to cure our to take care of our patients should also be equipped with the necessary information so that they can stay activated, healthy, and they can take care of themselves. All right. So on the other part, which is at the bottom area, we're also looking at, in addition to not just hardware, we should also be focusing on our own internal people as well. So it is really about how do we look after our people, how do we make sure that our people have access to the latest technology, and also in terms of knowledge and skills as well. Adding to that, we also look at leadership development. So at the end of it, when we look at all these things, everything comes together in what we call this river of life, so that we can support our population from growing up all the way to what we call dying well as well, right? Internally within NHG, we have a staff strength of approximately 19,000. We are still growing, like we shared earlier. Healthcare continues to evolve. There is really a lot of opportunities in terms of employment, comprising the four major groups: medical, nursing, allied health, as well as administrators. Within NHG, we don't only work hard. We really play hard as well. So some of the key activities that we have are really example like inter-institutional games. We also celebrate the contributions of our staff. Example through like on the top right-hand side, Education Leader Award. We also party a lot. We do have D&Ds. We also do a lot of philanthropy. Example like Cyclists with a Heart, so whereby we do corporate social responsibility activities. In addition to that, we also recognize very, very key staff of various profiles. Example like Nurses Day. We also celebrate Allied Health Professional Days. So these are little things that what NHG believes in, and we have been trying very consciously to engage our staff so everyone is plugged in and motivated to help our population grow well, stay well and healthy, right? In terms of staff opportunity for development, so as a staff, there is really a wide range of opportunities for you to enhance and deepen your skill sets. So assuming you do join us as a clinical staff, there are really a lot of programs, as you can see here. Health Manpower Development Plan, that's where you are given the opportunity to go to overseas centers to gain access to new skills, new technology, as well as new practices, so that you can bring back and then we can use it, adapt it for local health needs. There are also like process improvement programs, and we also give away scholarships for leadership development for those that show potential to lead. And there is a lot of in-service training, and definitely there are a lot of different seminars that staff are actually identified to attend locally or overseas, right? And pretty much before I end off, I think probably you may want to consider, like we shared, healthcare continues to evolve. The needs will change, but there's something that we are all aware of, like that healthcare will continue to be a sunrise industry. So if you're thinking about it, why not try to reach out to us, any one of us, through our booth later on, and we'll be happy to take questions there. All right. So that's pretty much what I have for today.
Okay, thank you, Chiming, for your sharing. I think we have time to take some questions from the audience. So one of the questions that I've received is, do you know whether the age demographics of the patients you see in the central region is different from compared to perhaps the west and the east and the other clusters?
For this particular interesting question,
Yeah.
I won't be able to address like directly, accurately as well. But what we know within the central region, we tend to have a little bit more patient that is towards the geriatric type. So, example, if you're looking at Kallang, Geylang area, that's really a very, very big pool of geriatric patients there. So, but within NSG itself, the northern region, which is like the Yishun area or even the Woodlands area, the study shows that, I mean, at least based on our study, we noted the patient profiles tends to be younger, and they are so-called what we call newly formed nucleus family. So the healthcare needs are really very different. So that's something that probably I can share within NSG itself. Yeah. Well, I'm not really addressing your question.
Yeah. I think there's no clear cut, like West is definitely having a more geriatric or East having a more geriatric population. I think it's pretty well balanced, and it's
probably
segmented into different like towns within Singapore as well.
In a way, yes.
Yeah. Okay. For NHG, I think we do see quite a number of unique institutions that are not available in other clusters such as your NCID, your IMH, and I know personally because I have prosthetics and orthotics scholars that DTSH has a very strong PNO foot limb clinic. So in terms of scholars who are keen to explore in these disciplines like PNO or perhaps be a mental health related AHP or nursing scholar, do you have any advice for them, or are there any developments in these areas that NHG is planning in the future?
For these areas, I think probably to address all these specific areas may not do justice in a way. I think rather we see it really at a system level. I think like I shared earlier, healthcare continues to evolve. There is really a need for not just PNO. I mean, PNO is a very, very niche area. But at the forefront, we do have certain needs that are starting to jump out a little bit. But as a whole, in terms of healthcare, there is really this increased manpower needs. But I think at the front of it, probably some of you may be thinking in your head, ask yourself why you want to enter the healthcare sector. That's something that we always advise all potential scholars. Do not really come in for the money. That's something that we always advise against. Reason because it should really come from it should really come from your passion itself, the passion to serve. Along with it, you will find the job satisfaction may actually exceed what you are thinking of from a monetary return aspect. So I thought at least I can call this out specifically.
Okay. Yeah, thank you, Chiming. I do echo what you've shared. In healthcare, even though we do pay our healthcare workers pretty well, I think it's a decent salary. But at the end of the day, we are looking at individuals who really have the passion and have the heart to serve those who are in need of healthcare services, and whether you have the ability to overcome certain challenges. Like for example, during the pandemic, we saw our healthcare workers, not shying from the front line and stepping up to do whatever that is necessary to prevent the pandemic from spreading further. So I do think that at the end of the day, this is an important aspect that we are looking at for our potential scholarship applicants. Yeah. Perhaps for the next question, we know that NHG has a lot of growing newer institutions coming up. So for example, your Woodlands Health Campus and different polyclinics, etc. So would you be able to share what are the challenges faced when setting up new institutions? Yeah.
For new institution, yeah, thank you. So for new institution, I think there's always that, how do we ensure our care delivery meets the needs of the population lah? So I think, for example, Woodlands, when during a setup, I think probably the key question that they were thinking of is really looking at how can we make sure we are geared correctly to serve the patient. That's probably one of the key areas. Once you have set how to deliver your care, the next crucial challenge probably is really how can we find the best possible staff to attract and to join us so that we can start to ramp up the services to take in the patients eventually. Yeah, and then once they are in, then when we go operationally live, this before they go live operationally, I'll call it the stress will come in whereby the load will come in to make sure that they are able to cope with the patient load. So probably these are the 3 key challenges that's facing new institutions lah. Yeah.
Okay.
Yeah.
Thank you, Chiming.
Okay.
Yeah. Would you be able to share in terms of, for the newer institutions or even for the big players within NHG itself, how has technology as well as medical advancement helped in providing better healthcare services for our Singaporean public in general? Yeah.
I see. So I'll probably use Woodlands again. So
Okay.
within Woodlands, they are, I mean, right now they are really in a setup stage. So probably in terms of integration with technology, they have been trying very, very hard. Reason because as we speak, healthcare workers is really in demand. So we know that probably from a demand perspective, we may not always have the luxury of having a lot of staff. So example, using Woodlands, they are really leveraging technology on how they can do, example, medication prescription, or even using technology in the wards itself as well, so that they don't have they don't require as many manpower, yet at the same time, the technology will allow the care delivery to maintain, if not exceed expectation. Yeah.
Okay.
So what they have been doing, exploring. Yeah.
Okay, thank you, Chiming. I think that is a good insight to know that the medical advancements are moving within the cluster itself, and with the newer institutions, there will definitely be newer technology being embedded as well as integrated within the system.
Maybe can I just add a little bit as well?
Sure.
Probably not just only the newer institutions. So if I may quote Tan Tock Seng Hospital, arising from new technology and as well as new challenges, they have also started to review how workflow may also help to give new services as well. Example, clinics, they are slowly evolving into a model whereby there is clinics without walls. So it takes away a whole thinking altogether. So not just purely from a technology perspective, but sometimes the flow of the processes as well as the actual human traffic flow, there are opportunities to see how we can better improve on the care delivery. Yeah.
Okay, thank you, Chiming. So for I'll ask this question. So for scholars who are interested to join NHG, would they have opportunities to rotate within the cluster, or
so
you'll be
I think
allocated?
probably this, I think this was something that was asked in the last panel as well.
Yeah.
So, I think probably we would like to share on this. So as a scholar, when you are allocated to an institution, that's something that probably we wanted to impress as well. Is that as a scholar, we will try to make sure there is a perfect match of your aspiration in terms of location, as well as making sure that we will equip you to succeed to the best that we can. So typically, once you have finished studying, coming back to serve your obligation, typically we do request very, very strongly that you stay with your institution until you finish your bond. Reason because in the first few years, you are really consolidating your medical or clinical training. So after that, you will need to start to apply. Only then you will be able to what we call discharge the role independently. Typically, it's around 3, 4, 5 years, thereabouts. So that's the reason why we do actually impress that we do not encourage cross-cluster or even cross-institutional transfer. Reason because on the other hand, your hosting organization might have already put in some development plans for you to progress in terms of career development. So for you to put in a request, that could probably be quite disruptive from their end, from a manpower perspective, and also from your what I call a professional development angle as well. So that's something that we do not actively encourage. But in the same breath, assuming if there's something that something comes along unexpectedly, we always encourage scholars to kickstart conversations with your reporting officer to explore, assuming that in the longer run, is there something that you can facilitate? So we don't say no, but we certainly don't encourage. But I think along with it, there is the need to engage everyone on the same page lah. So no one is caught up by that. Yeah.
Okay, thank you, Chiming. I also want to just add on that in terms of being like a fresh grad and you join a certain institution right out of school, you will need to take time for especially I would think at least 1 or 2 years to actually know what you're doing and be comfortable with it and be independent at work so that you are able to actually contribute to whatever role that you are in. So in terms of rotation or any transfer opportunities, I would think that is something that you can think about when you are more mature and you are more I would say like deeper in your career and you have a better understanding of what you want in terms of the career pathways that you like to move into. Okay, I think we've come to the end of NHG segment. Thank you, Chiming, so much for your sharing for all the institutions within NHG and answering the questions. Okay, so now we'll move on to the next segment. Okay. For the last segment, we will have Lim Sok Luan, who is the Deputy Director of Strategic HR at Sing Health. She will share more about the Sing Health cluster. Sok Luan, please. Okay. Sok Luan, do unmute yourself before you start your presentation. Thank you.
Okay, sorry. Okay. Thank you everyone for still staying around. Welcome, ladies and gentlemen, to this segment of Sing Health presentation. I will share with you the overview of Sing Health. Okay, what about Sing Health? I think in the earlier part of this seminar, much has been talked about the reclustering. So Sing Health is looking after the east and the lower end of the central part of Singapore, which is considered east in terms of the clustering of the public healthcare in Singapore. So in Sing Health, these are the institutions we have. I'll show you the next screen later. And based on the 2018 statistics, we are the largest healthcare in Singapore, healthcare cluster, and we look after 45% of the A&E admissions. We look after 51% of the specialist patient, and for inpatient, we are looking after 49% of the population's admission in the public healthcare. And now we are the largest public healthcare cluster in Singapore. First, we have the largest workforce. As at the August number, there are almost 30,000 of us, with nursing comprising the largest. And we have a very big group of admin and ancillary staff too. Okay, in Sing Health, we have primary healthcare, which comprising the polyclinics and a network of GPs. And the secondary, tertiary, and quaternary care, we have the hospitals at tertiary care. We have Singapore General Hospital, Changi General Hospital, Sengkang General Hospital, and KK Women's and Children's Hospital. Over at quaternary care, we have the specialty center, which is Cancer Center, Heart Center, Neuroscience Institute, Dental Center, and Eye Center. And over at the continuing care, we have the primary health care, comprising 3 community hospitals, Bright Vision, Outram, and Sengkang. So in Sing Health, they are together, there's 42 specialties spread across the whole cluster. We divided ourselves into 4 campuses anchored by the hospital. So over at SGH campus, which is based in Outram, we have the largest concentration of tertiary healthcare facilities in Singapore. And over at over at KK campus, which is a KK hospital, the focus is on women's and children's healthcare. Changi campus is in the east, so it looks after the regional health system for eastern population. And Sengkang SKH campus is for the Sengkang General Hospital, which is focusing, looking after the healthcare for Northeast residents. We do have a network of polyclinics that does look into disease prevention, primary healthcare, and family medicine. And most of our admin and support functions are based in SingHealth Connection at Bukit Merah. And as part of SingHealth UNS Academic Medical Center, our medical school is actually Duke NUS for a postgraduate program, and it's co-located on the SGH campus. So I'll share with you the institutions in SingHealth. SGH is the largest and the oldest public hospital in Singapore. This year, we'll be celebrating 200th anniversary of the founding of Singapore General Hospitals, and there will also be a Med 200 celebration along the way. Over at Changi General Hospital, over at Changi General Hospital, it is a medical center excellence with focuses on a few key services, and it's also very, very strong in sports medicine. And for those who are very active sports person, you may actually have a chance to go there for rehabilitative treatment. Sengkang General Hospital has been working very closely with the Northeast residents of Singapore and the community to deliver a holistic healthcare. And this is actually a younger part of younger town of Singapore, so the population there tends to be younger. So the services there will look into like eye center with children's facilities as well. KK Women's and Children's Hospital looks after the women's and children's health in Singapore, and it's actually a key leader in ONG, PEDS, and etiology. And for students who will be keen to work with children, KK Hospital could be a place to consider. National Cancer Center is a comprehensive, customized place for all key oncology matters in Singapore. And over there is also a one-stop specialty center, the largest regional pool of oncologists. So there'll be a new building coming up, which is targeted at 2022. I'll update the figures and later I'll show you. At Dental Center, it's actually integrated care for dental condition. Besides dental condition, it's also looking after matters of upper jaw and oral health care. You work closely also with the specialists from Singapore General Hospital and other SingHealth specialty centers. Heart Center is the specialty centers in cardiology treatment in Singapore. So it's actually a recognized center of excellence for treatment of complex heart and lung diseases. This new building was opened in 2014 and is currently a very, very busy place. And for those who want to have a focused career development in heart and lungs matter, Heart Center is one of the places you consider. Science Institute is actually one of the leading regional specialist center looking into brain, spine, and nerve and specialty matters. And it's also one of the world's first fully integrated brain suite with the ability to perform complex surgery. So it provides 70% of the neuroscience clinical services in Singapore. National Eye Center is also one of the, it is a one-stop international center focused on eye care. For those students who are actually with myopia, maybe from one time or another, you will have visited the SNEC at SGH campus, or maybe some subspecialty centers throughout Singapore. SingHealth Community Hospital, comprising the Bright Vision Hospital, Sengkang Community Hospital, and Outram Community Hospital. So it's actually for step-down rehabilitative care. So after patients are being discharged from the acute hospitals, they may be sent to these hospitals to continue their treatment, but in a step-down condition. So for those students who are keen on community health care, you can consider the community hospital as a place to develop your career. SingHealth Polyclinics look after the population mainly in the eastern region of Singapore. So currently we have a network of 8 polyclinics over at Bedok, Bukit Merah, Marine Parade, Outram, Pasir Ris, Sengkang, Tampines, and very soon it will be Eunos. Okay, what is the future plan of SingHealth? The SGH campus will be revived, and by 2030, it will be the largest medical campus when completed. So these are just some of the master plan. Already, the community hospital has already been built and operationalized. Up and coming will be the National Cancer Center by 2022. There was a delay due to COVID. Initially supposed to be open by this year. There will be a new A&E facility at SGH, incorporating National Neuroscience Institute. And by 2024, there will also be a new elective care center and a dental center built along Bukit Merah to augment the current facilities at SGH. So this is how SGH new hospital will look like by 2030. So currently we are into phase 1, which Outram Compound is operational. Cancer center is up and coming, and certain part of SGH at NDCS will be built along the way. And then by 2030, there will be a new SGH campus, and new NNI and SGH and KK will also be developed. This will show you that this is a new National Cancer Center. And there will be a new Physiotherapy therapy center after a new treatment for cancer patients too. For those people who may be keen to consider a primary healthcare career in a polyclinic, you may want to know that there will be more polyclinics coming up, and there will be a lot of opportunities for people to consider. There will be Tampines North, Kaki Bukit, and a new Tiong Bahru Polyclinic, which is a combination of Bukit, which is amalgamation of Bukit Merah and Outram clinics. Existing polyclinics like Pasir Ris and Sengkang will be developed. So this is the map of how the whole SingHealth institutions will be developed. So this is some of the photos for you to see. And SNEC also be developed. Currently, there's only one building at SNEC, but the building facilities will be expanded into the Boyer block, the old, which is called a clock tower block, to increase the care. As the aging population, there'll be more needs for operations such as cataract and glaucoma. So there's a need to expand the operating theatre, day wards, and incliners. New Eastern General Hospital being built near the Bedok North MRT station will be ready by 2030. And this new hospital will help to ease the patient load at Changi General Hospital and also to cater to the needs of Singaporeans in the East. It will be a full facilities. At the same time, as this is a new hospital, you engage the local community for design and to co-create ideas to meet the needs of the residents. So what I've just shared is actually the infrastructure. So for patient care, what is so special about the SingHealth patient care? In SingHealth, we work together with Duke NUS to develop the SingHealth Duke NUS disease centers. So this is actually coming together a multidisciplinary team of clinicians to look after a full cycle of care condition for the patients. So through this teaming up, there'll be consistent protocol to treat patients, structured training and standards, and the various disciplines, various clinical teams or disciplines will come together and joint accountability to look after the patients. More importantly, the various institutions in SingHealth will come together for a more extensive database so that they are able to develop better data to look into better treatment for the patients. So currently there are 9 Duke NUS disease centers from head and neck, lung, breast, diabetes, blood cancer, sleep, sports and medicine center, transplant and genomic medicine to provide this care. Let me explain some of this at the next few slides. Head and neck. Head and neck actually is it is not looking after a special medical condition. It's look across a suite of condition of a patient. So at the upper boxes here, these are mainly the clinical, but under neck and head and neck include children's matters, ENT, which is ear, nose, and throat. All these are cancer matters, so it involves cancer of the jaw, cancer of the mouth, cancer of the nose, This when doctors come together, and radiological science actually is for imaging, X-ray, pathology is on the organs, as well as blood, and oral health is actually of the teeth. Why is oral health, which I mentioned just now, National Dental Centre involved over here, is because for patients with mouth or nose cancer, sometimes the upper part of the body, of the face, can be deformed. So this is when the dentist will come in to do reconstructive surgery together with the doctors. And then beside this medical treatment, there will also be a need for multidisciplinary care. That's where the nurses, the physiotherapy, dietitians, wound care nurse, social worker, speech therapy, and services come together. So when one of the patients is warded in the hospital or is need to see a doctor, this whole team of different disciplines will come together to treat the patient instead of the patients going after this clinic to clinic to get themselves treated. For diabetic care, beside the doctors, the polyclinic will look after prevention like pre-diabetics, and when there's actually there are people with early stage of diabetes, they can also seek treatment at the polyclinic. But when cases have become serious in the stage, so the doctors also come in from the endocrine, the renal, looking after the kidney, internal medicine, vascular surgeries where the veins are involved. Because some patients, when they do kidney dialysis, they need to have all these things being planted in the body. And vitreoretinal is for the eye-related services. Because some of the diabetic patients may have eye issues. Then, of course, they also be complemented by nursing care, podiatry, because some have gangrene feet. A dietitian talk about the diet they need to have in order for them to have a good diet to complement their current medical condition, and physiotherapists will help those with post-surgery or who are in a rehabilitative mode to improve their health. So after looking at patient care, we'll talk about the staff in SingHealth. So nurses, we call them the proud of SingHealth is because they are really very important component of our medical team. So besides doctors being specialists, actually nurses also have specializations for them to look into. Some of this involve going for advanced medical treatment, as well as graduate diploma. And then with that, they're able to go into specialization care for their patients. In SingHealth, our nurses, beside the usual clinical education and management track, also encourage them to go into research and informatics. This is where they are able to develop their career further. So for those people who are in ITE now, upon getting a diploma, they can also move on to become a staff nurse. And from staff nurse, they can themselves move up into senior staff nurse, assistant. Ultimately, through the different tracks, able to take on more senior role and become director of nursing, chief nurse, or group chief nurse. For allied health professionals, our tagline is many talents, one passion. Because in SingHealth, we recognize the AHP specialties, of which 14 are being offered as a pre-service scholarship. So similarly, for allied health professionals, besides the generalist and management track, there's also the clinical, where for them to focus on their clinical practice, and research to improve ways to provide better care for the patients. And education is for them to teach the students who are in school, as well as to enhance teaching of the existing staff. So scholarship actually is being offered by MOE, as being mentioned. So for those students who did not get a scholarship, they can consider cluster sponsorship, which is managed by the institutions. So for sponsorship, it's actually allowing the students to get a head start with a career in a SingHealth institution. So for nurses, actually sponsorship being offered for degree, diploma, and NITEC. And over at the various education pathway, there will be different quantum of sponsorship allowance for them. And over for sponsorship, the students are actually able to get the allowance for, the bond for sponsorship depending on the period of a sponsorship. So if it's a 1 year sponsorship, the bond will be 1 year. And for allied health professional sponsorship, is offered for those studying at NUS, SIT, or sorry, it should be SUSS. It's for diagnostic radiography, medical social work, occupational therapy, physiotherapy, and radiation therapy. So for those who are keen to apply for sponsorship, you can actually go to the Sing Health website and under the career portal to find out more information. And this is our contact, which you can actually look for it. Okay, amongst the some who are actually working adults. So if you also consider a healthcare career, you can actually consider joining the professional conversion program for nursing or allied health. That depends on currently what is the qualification you have, and then you can decide your career path accordingly. You can always go to Care to Go Beyond website to find out more about the various opportunities for you. So in Sing Health, all of us are united by a common purpose, which is patients at the heart of all we do. So if you are keen to join the public healthcare, you can consider one of the public healthcare classes of Sing Health, and we will always welcome you. Well, thank you very much.
Okay, thank you so much for your sharing on Sing Health and the respective institutions within the cluster. I think we have time to take about 1 or 2 questions.
Yes.
So the first one being, being the biggest healthcare cluster in Singapore, what kind of challenges does the Sing Health cluster face?
We do have because our challenge actually is that we do have many practices, so it's always harmonization. So, but we also want to retain so-called the uniqueness of each institution. So we also have to ensure that there is this thing called the matrix. It means it's a common practice across Sing Health, but each institution has its own uniqueness. So like children, it's like pediatrics children is a very specialization. So that they care after special care for children matters. But in terms of so-called adopting common practices like so-called operations, operating theatre practices, that is being put across so that everyone is practiced, so that there's a common practices adopted in terms of workflow. But in terms of the specialty, the treatment, will be based on the professions. Or even like HR, our staff, we have common practices among, so that the staff in the different institutions do not compare. But of course, each institute also has its uniqueness because of the environment is different. So there's a need for us to be a bit more specialized. So being the largest, we do have some need to harmonization for consistency in practices, but retaining the specialties. Yes.
Okay, thank you, Sok Wan. I think with the many institutions and many specialties available in Sing Health. So for example, when a patient is admitted to perhaps like a general hospital and they have a heart condition and they perhaps have to be shifted towards the cardiac center, does this actually allow the perhaps future scholars or HPs and nurses to actually work closely with institutions, staff from other institutions, even though they may be from different institutions within the cluster? Yeah.
Okay, so maybe I use the heart center. Because National Heart Center does actually have a basis for scholarship. In the sense that within the heart center itself, they had day wards. So it's round the clock. But post-surgery patients actually is in SGH itself.
Yes.
So the nurses or the HPs, they actually move across heart center at SGH. So physically, you don't feel the difference in the sense that you're still part of the hospital, but their specialization and focus will be on cardiology matters. So this is where they specialize. But in terms of harmonization practices, it's quite similar across. And then for the patient, actually, it's a similar treatment. So after surgery, they will be discharged, and then subsequent follow-up, they will go back to the heart center for their post-surgery follow-up.
Okay. Thank you, Sok Wan. Okay, I think we can take one last question. So perhaps you can share what kind of qualities and skills is Sing Health looking out for in prospective scholars? Yeah.
Okay, I guess I say we are all in public healthcare. So we have patients coming from different backgrounds. So our scholars, first of all, must be very mentally resilient, able to take the fast pace of the hospitals. I must admit that Sing Health, we work very fast because of the patient, because of workload. So there are a lot of patients coming to us. So all the healthcare workers in Sing Health, we have to work fast in order to clear the patient workload. So, and then the scholars after graduation, they'll be put to different training programs to prepare them to undertake the demands of the patients and the caregivers. So just like any typical professions, good communication skills, able to solve problems, can think analytically, think on the feet, and mentally resilient. And okay, in healthcare, one thing you must do is you must follow instructions, especially those front line, because we recognize there's a need for creativity and being innovative in looking at new treatments. But in the process of treating, there's all this protocol, all these processes that you need to follow, so you have to follow instructions. So so you must be able to balance and differentiate the two. Yeah.
Okay, thank you. So I do want to add on that in terms of allied health and nursing professions, patient safety is always the most important factor.
Yes.
Like no matter what you do, patient safety is the thing that you should prioritize. So
Correct.
even though you may want to come up with new solutions, that must also be tested and proven effective before you can actually implement it within your recovery process for your patients. Yeah.
Yeah, so that's why you look at the research education track, this is where you can explore and teach away. But when it comes to the clinical function, you have to follow the instructions.
Yeah. Okay, thank you so much. I do think that the different pathways will allow individuals with different interests to develop themselves within the career pathways. And within SingHealth, there are so many different specialties and institutions. So scholars will have more than enough choices to look into to decide where their passion lies and where they would like to pursue their careers. Okay, thank you so much. I think we have learned a lot about SingHealth in your sharing today. So it's about time, so I'd like to end off the session. So thank you again to all the speakers for taking time to join us today. And we have also addressed quite a number of questions from the audience, and I hope that the sharing have benefited you and allowed you to understand a bit more about the different healthcare clusters as well as community care sector in Singapore. Okay, we have come to the end of this session. If you have enjoyed this session, please help to rate the program at the bottom left of your screen. Okay, and our next session will be Walking in a Healthcare Professional's Shoes, which is happening tomorrow at 10 a.m. Okay, this will be an interactive program of walking a mile in the shoes of various healthcare professionals involved in a patient's healthcare journey. So join us because there will be polls and there is an interactive activity where you can participate as well. And we look forward to seeing you at our upcoming sessions. Go on and have fun as you learn to dare to care in our online seminars and virtual activities. Thank you once again.